Hello all! I just wanted to make a quick video about the procedure that I'm getting and any choices that I've had to make and why I've made these choices. I'm having bilateral double mastectomy skin sparing. The expanders put in right after the mastectomy while I'm still under, and I think he said he's going to put a little bit of saline in there to give me, so when I wake up I don't have like a concave chest. A lot of friends and family think that I chose to get a double mastectomy, and that's not the case in this situation. I didn't. I thought I'd have a choice. Actually, when I went to the appointment with my surgeon, she kind of said it like, okay, so you're getting a double mastectomy. Like, there's no other choice. Like, that's what I have to get. My tumors are massive, and so in comparison to my breasts, even though my breasts are decently big, there's not enough room in there, and if I were to get lumpectomies, there simply wouldn't be enough breast tissue. Kind of expected to have this happen. My mom, I think it's 3 years ago, she also had a double mastectomy. She had breast cancer. I said had, which sounds bad. She's still alive. Of course, she got the double mastectomy, which saved her a lot. Her mom had breast cancer as well, and my mom's mom also had breast cancer. Just strong family history, so this is probably a good choice anyway. The reason I chose to not save my nipples is because I have the type of tumor called a Phyllodes tumor. With Phyllodes tumors, they kind of grow very quickly. It's a type of breast cancer, and they can be either, and I'm not a doctor, so if any of this information is incorrect, then just let me know. This is just what I've learned from research. There are 3 types of Phyllodes. There's the benign, the malignant, and the borderline. All 3 of them are considered breast cancer because at any stage, of course, I guess not including the malignant stage, the tumor can turn malignant. Even if it's benign, it can switch to malignant. And usually when you've had a Phyllodes tumor before and you get it removed, it usually grows back, and when it does, it's mega super aggressive, and it's just way worse than it was before. So I didn't want to risk that. I made the choice. It was almost instant. I didn't realize that I was going to be making a choice like that at the doctor's that day. I didn't come prepared. I didn't know what to expect that day. Yeah. But I feel very confident with my choice. I know that I would have regretted my decision if I completed the mastectomy and the reconstruction with my nipples, and I'm like, whoa, cool, awesome, and then I get checked and the tumor is growing back because of my nipples, and I would just have to get everything removed. It would kill me. So I believe it's a good choice. I understand that there are different situations for different people. I'm not trying to give advice to anyone. I'm just trying to say what I think and why I chose what I chose. I don't know. Maybe that'll help you in some way. The reconstruction. Okay, so my mom had, I think it's called like deep flap reconstruction or something, and that's when they can cut like skin or something from like your stomach, your butt, or like your upper back, and they use that flesh and they like create breasts, which is pretty amazing. That's pretty cool. And there's also the reconstruction where it's like they put expanders in and then eventually they switch it out for implants. That's the kind I'm gonna get. Expanders, and I'm gonna have silicone implants. I chose that because the surgery is not as intense, and I don't don't know. I mean, that's kind of like what the surgeon recommended to me. And I thought, yeah, I think that sounds good. So that's what I ended up going with. I kind of already had that one in my head whenever I went in to see the surgeon, so I was happy when he said, yeah, I think that would be the perfect one for you. So I was like, yes. Yeah, though that's the procedure that I'm going to have. Those are the reasons why. Indeed. Sorry if my talking's not that great. It is 3:30 in the morning. Technically it's Wednesday. No, technically it's Tuesday, and my surgery's on Thursday, so I'm a little nervous right now. Yeah. Okay, I need to stop talking. Again, this video is way longer than I wanted it all, so sayonara.